like for any radiograph, after having looked at quality of the radiograph, if it's interpretable or not, we first of all going to have a quick look at the extrathoracic structures. Secondly, we can have a look first at the cardiac shadow or at the respiratory system, depending what your priority is, but as long as you use always a systematic approach, you will not forget and overlook something. Looking at the cardiac shadow first, on the dorsal-ventral radiograph, we have a typical reversed D shape. By using a clock, we can help in determining where the great structures, like the great arteries and the different chambers, should be positioned. From the 12 to 1 o'clock position, we have the typical bulge of the aorta. From the 1 to 2 o'clock position, we see the pulmonary, one of the pulmonary arteries. If there is enlargement of the left auricle, it would be visible from the 2 to the 3 o'clock position, which isn't present here. This is where the left ventricle is lying, and the reverse D sign is showing the right side of the heart, with the right ventricle being from 8 till 11 o'clock and the right atrium from about 10, 11 to 12 o'clock position. On the dorsal ventral radiograph, we also have a good idea from where the trachea is positioned, the bifurcation with its both two branches, and we have an idea of the pulmonary circulation. Definitely at the left side of the thorax, which is the right side visible on the thoracic radiograph, we have a reasonably good view on the width of the pulmonary arteries and pulmonary veins. Be careful not looking in this area where you will have superimposition with the cool vena cava and might wrongly interpret pulmonary vessel enlargement for that reason. Like for the dorsal-ventral radiograph, on the lateral radiograph, we will also first of all examine the extrathoracic structures. Look at the sternum, the vertebra, the ribs, before concentrating on the area we are really interested in. It can be the pulmonary parenchyma or it can be the cardiac shadow, and very often it is both. If we're looking at this cardiac shadow, it is in a dolichocephalic bridge, a little bit elongated, and we have the left atrium at this 1 to 2 o'clock position. This is where the left ventricle is located. The right ventricle at the cranial heart shadow border, and the right atrium sitting at the tel 11 position. We normally clearly also see the aorta with its ascending aorta with the aortic arch and the caudal vena cava bringing blood back from the abdomen. Every bronchus is accompanied by an artery and a vein. On the lateral radiograph, the artery is lying dorsal or above the bronchus and the vein is lying underneath. They should be similar in size or in width at the same intercostal space. On the dorsal ventral radiograph, these pulmonary vessels are lying with the artery at the outside and the vein lying at the inside. So the bronchus is accompanied by an artery outside and a vein at the inside. Once again, they should be similar in size in a normal patient.